This next question is actually from the UK, so we're literally going all around the world. And since it's a really long question, I'm going to let you take it, Doc. I don't want to read it.
Got it. Hi, Doc. One of your UK followers here. Thanks for watching. From searching through most of the videos, I can't seem to find one that applies to my case in terms of PCT restart drugs to use, dosages, and length of time to run them. This is quite a long-winded request. That's why Dave made me read it.
Yeah, that's right.
I really hope you can answer it, as I've exhausted all venues I know of and am left in a bit of a mess, to say the least. Now the problem I've got on my hands. I've recently found out I have low testosterone. My levels are currently the equivalent of a man in his mid-80s, or you might say a little girl in her, pre-teens, right? As I teach people, guys that come into my office. I have all the symptoms: depression, anxiety, small testicles, no spontaneous erections, low libido, etc.
Ouch.
Looks like he's got UK measurements. Well, for the UKers, total testosterone is 13 nanomoles per liter. Free testosterone 0.182 nanomoles per liter. Sex hormone binding globulin is 57 nanomoles per liter, and the free androgen index 22.8. U.S. measurements, approximate conversion. Total test is 370 nanograms per deciliter. Free test 5.3 nanograms per deciliter. I doubt that. It's probably picograms per milliliter. But anyway, sex hormone binding globulin is 57 nanomoles per liter, and the same free androgen index. This could be down to using excessive amounts of various steroids on and off from the ages of 20 to 26. I'm now 29. I say could be because I had all the symptoms of low testosterone way before touching anabolics / exogenous testosterone. I will admit that due to my lack of education at the time, I ran things for way longer than what I should have without the combination of ancillaries. I also never took adequate time off to get my body / hormones back to normal in between cycles. There were a few occasions toward the latter part of my use that I did some form of PCT, post-cycle therapy, after doing bits of research over the past few years. It's safe to say I never followed a full recovery protocol. The struggle I have is the National Health Service we have here in the UK. They are trying to tell me that everything is within the normal range, which is ridiculous. We have the same problems here sometimes. Even I can tell that those numbers are not normal for a man my age. The endocrinology department have said we don't test for free testosterone, and that they won't pursue any further investigations or treatment. Basically, it's an indirect way of them saying we don't want to waste our time and money on you when it can go somewhere else. So their course of action is more likely based on budgets and costs as opposed to treating my actual symptoms. Again, welcome to the healthcare system occasionally, or more often than not, unfortunately. It's been 3 years since I've taken anabolic steroids, and if my endogenous production was to normalize, it would have done so by now. Just stop here for a second, because this is a long-winded one. Have we got an age? No, he hasn't said his age yet. Oh no, he is 29. Maybe. I suppose this leaves me with the only option of taking matters into my own hands. A private company I've spoken to have said they will treat me by HCG monotherapy at 1500 IU every other day, alongside Arimidex for estrogen control. Apparently this route would be something I'd have to be on forever to boost my natural testosterone production and maintain fertility. The worry I have, isn't there a high probability of becoming desensitized to HCG and burning out the Leydig cells at that high of a dosage on a permanent basis? Let me just stop here and take a breath and answer that one, because I don't want to get too lost here, because I have to memorize all this stuff or remember what I'm reading and then talk about it again. So, 29 years old. There's a lot of reasons why T could be low, and for a 29-year-old, 370 nanograms per deciliter is pretty doggone low, and especially 3 years after not using anything in a super physiologic or anything exogenous that would beat down your natural production. Is it safe to say that it'll never come up again? No, not necessarily, because I don't know what else has been going on. Stress kills. There are other factors than exogenous testosterone that cause your endogenous production to no longer work as well as it used to. So is hope lost? No, not necessarily. There are some, what he's referring to as post-cycle therapies. There are therapies that are very successful, certainly at age 29 still, such as Clomid, not my favorite because there are a lot of side effects that can come with that. HCG, which he mentions here, along with either, my favorites are the AIs, the like a Remedex here in the States, just because I like the elegance with which it works. In other words, you preserve testosterone by not letting it convert. So we're saving the thing we want to keep high as possible, and then we're controlling our estrogen, not by blocking the receptor, but by not letting it convert except for the small amount we need. So HCG and AI is my favorite for trying to restore testosterone levels in guys just like this that come in. Careful not to beat yourself up too much either, because, as I said, it's not necessarily just the anabolics that you used. And guys do this, I should never have done that. And maybe you shouldn't have, maybe you should have, I don't know. But it doesn't necessarily destroy you. Now, you're rolling the dice more if you're doing these while you're still forming what we used to call hardwiring of the HPA axis. Now we call it more soft wiring. Certainly, but plenty of guys get through using anabolic steroids when they're younger and still developing and come through it, and they're not ruined. This could be from other factors. So just so you don't beat yourself up and say, well, I never should have done that and that's why I ruined myself. Technically speaking, he was taking it when he was still younger, but you haven't been on anabolics for 3 years, so you should be in a good place at least to try and bring it back up if you want to try to do so. 1500 IU every other day of HCG, yes, that's usually considered high. The problem is if you go to the research and say, well, on what basis do we come up with this figure that most of us in the profession agree upon? 500 IU a day of HCG, no more than that, and you won't desensitize the Leydig cells. Where are the studies that show that? I haven't found any. It's kind of one of those things where, and you got to be careful with this, obviously, that's why I'm mentioning it. It's common knowledge. I don't know that for sure. And of course, everybody's different. It is kind of a high dose to start with, though. How's that? And I would consider maybe starting off with 500 IU every other day, which in my practice is usually a sufficient dose. If you're having trouble after, say, 6 weeks at the most, 3 to 6 weeks, seeing that number come up, then maybe go to 500 every day. This is just what I use and have had some success with in the United States. So 1500 IU every other day does seem a little steep. I don't know how much Remedex you've been recommended, but we certainly want to keep it. I like to keep the estrogen down as low as possible, what I call optimum, without being without enough estrogen for brain health, cardiovascular health, and joint health. So 15 to 20 picograms per milliliter of estradiol is where I like to keep it, and that works for restoring as well. I think we've talked about.
How often do you have people tested for that, though? Because when you start, taking the blood test at the beginning, you'll do the medication for, such as the anastrozole and all that stuff. And when do you have them test again to see if you have to change the numbers?
Good question. It all depends. At the end of the day, unless someone's coming to me to discuss fertility, which is something that has to be measured, although it doesn't have to be. I mean, if you get a child, you get a child, right? But first and foremost, remember, we treat people, not numbers.
Right.
So if after 6 weeks, patient goes, wow, doc, this is great, it's working, I feel fantastic,
then don't worry about it. Yeah.
It's up to them. Yeah. But I'm not pressuring anybody. I don't pressure anybody necessarily, but I really, I'm interested certainly to see what the numbers are, but I'm a nerd, and the data points would be nice to see, but I'm not going to, again, I'm going to say, well, great, we're successful, let's move on.
I see.
Also, if it doesn't work, you go, well, we can try something else clinically, like let's say we've been doing 500 IU every other day, well, let's go to 500 IU, depending on the patient. But then, that's more likely a case where I'll go, I would really like to see the numbers and see what's going on at some point if we have failure, because what if the person doesn't feel well because of something else that I might have missed? The testosterone levels are back up to normal, they're optimum, they're doing great, but you still feel miserable? Well, let's look at something else. Okay,
so how long would that period be then? Until they actually start feeling better?
Normally they can feel better within a week or two if they respond well, of course. If they go from 370 to 980, that's great. And typically they feel better. Although there are some, and probably not for this question video, there are some exceptions to that rule where I go, well, gosh, the levels are up, but you still don't feel good, and we've chased everything else, and we get them on the replacement therapy, and they go, finally I feel good again. So there are some exceptions, but typically, yeah, they bounce up really well like that. To answer your question, I say, look, give it at least 3 weeks, because yeah, what if they were getting a flu or a cold or something that they'd had before and they were fighting it and they feel miserable because it's something totally different. That they would have gone through in 3 weeks, but at least 3 weeks, preferably 6 weeks before you say, okay, let's throw in the towel and try something else. So that give you an idea.
Gotcha. Okay.
So we don't know about what, the real level that desensitizes the Leydig cells, but it's good to start low and move up, certainly, and those are numbers that I've worked with. My goal, if possible, is to coax my body/brain into being able to produce an optimal level of testosterone naturally and to preserve fertility, ultimately without the dependency of drugs. The conflict in opinion/data on the internet is very confusing, to say the least. Yeah, I feel as if I've hit a bit of a crossroads with all the information. I'm hoping you could advise me on how to go about correcting this the right way. Would you recommend attempting a PCT or restart to try to attain natural levels first? If I could get away with doing that, I'd like to do so. If it fails, then hormone intervention can be a second option. Certainly. So there, again, yeah, at 29, I would definitely start with HCG or Clomid, something to try and get your own natural levels up first. Definitely. For fertility reasons, for a lot of reasons, not the least of which is, hey, replacement therapy works great, but if you can avoid having to get on replacement therapy, it's like, hey, reading glasses work great, but if I can avoid having to use them until I actually need them, I mean, really, it's I know that sounds simple, but it's practical. And you're young enough, and I don't think that you've exhausted all your options from what I'm understanding here. I don't want to jump on something for life if there's a chance I don't have to. I'm assuming that a full PCT would be the only way of getting around, getting my body and HPTA functioning optimally on their own. Well, you've gone cold turkey. That works pretty well oftentimes. The body screams. The lack of testosterone affects the pituitary in such a way that it sends tons of luteinizing hormone to the testicles and gets them to work. What's interesting here, though, with regard to that is, he says, didn't he make reference to sort of half-stepping with the PCT? You didn't get that full cold turkey, oh my gosh, where's the testosterone? So maybe that's part of the problem. So again, definitely I would give it a shot, no pun intended, at trying to bring up your endogenous production once again. So he's presented a protocol here, 1,000 IU every 3 days for the first 2 weeks, 500 Arimidex 1 milligram every 3 days for the first 2 weeks. This is really, really detailed, and I can't give you any basis for why you would change it, after the first 2 weeks and whatnot. This sounds like something from, deep in the depths of the internet. I mean, really, and I'm assuming he didn't make this up himself. I don't mean to be disrespectful, but this sounds like something that somebody made up, particularly because you got HCG, Arimidex, Clomid, and Nolvadex, and Aromacin.
Oh, come on. That's a bodybuilder cycle.
Yeah, I mean, that's just overkill. Yeah. One is all you need. And the idea is you're trying to get the estrogen down low enough so that eventually the pituitary will send luteinizing hormone, which it won't if either testosterone or estrogen is high. We've talked about this before, because estrogen is made from testosterone. If it's high too, your body won't send a signal to make more testosterone. And by the way, if you mix Arimidex with Nolvadex, you're going to reduce the efficacy of Arimidex too. So choose one, stick with it. And again, in my practice, the protocol I would use initially would be something akin to anywhere from 250 to 500 IU every other day, along with anastrozole, probably 3 times a week. Probably to be on the safe side, to over-suppress if anything, but all depending upon what I see in the labs. I've had guys where I go lower, I've had guys where I go higher with the Arimidex, simply because when they come to me, they might have higher than usual levels of estrogen to begin with. You got a 370 total T, but you've got an E2, an estradiol of 63 picograms per milliliter. More likely to go with the 3 than the 2 for sure on that, or maybe even every other day, just to make sure we bury it enough for the body to not get mixed signals. I don't want to do any more damage to myself than I already have. I already talked about that. Don't think you necessarily did that. It might be something totally different than having used anabolics for a time period. Think about that too for a second. Another example is women use birth control pills all the time. Now we are finding that women who are starting at age 15 and 16, we have studies coming out showing that, yeah, there's a long-term suppression. There apparently is some damage caused to the HPA axis that means they're never going to produce the same way we think they might have produced had they not done birth control. But in this case, as long as you didn't do, start at 15 and go non-stop with anabolics, again, don't think that you can't restore them or that you screwed it up.
It's a common fear, I think, for people, for bodybuilders at least.
Right, but again, a perfect example with women is you suppress not just one, but two, actually three. This is the funny thing with birth control pills. You got a guy whose girlfriend's father's a doctor, gets her on birth control pills. I know this story. And he thinks, great, we're going to have sex more often now unprotected, and it's going to be fantastic. I don't have to wear a condom or whatever it is, But she gets on birth control, and not only is the estrogen and progesterone suppressed, but so is the testosterone. So she's not as interested in sex anymore.
That's
right. Blew it, right? So in this case, again, if you look to most females, they can be on birth control pills certainly after age 26, go on them for 10 years straight, and then decide, okay, I want to have a child now, and stop taking them, and within a month to 3 months, they're pregnant again, depending on what's going on. So same thing can happen with guys. All right. So again, I guess the upshot of that segueing is, give it a try. 29, get your fertility back and get your own production back. Hopefully for another 15, 20 years until you actually quote unquote need testosterone replacement therapy. And that goes into just one more thing. I don't want to have to be dependent on anything. Well, good luck with that. Do you remember when Mom told you? I do remember this, when Mom said, well, son, if you want to keep your teeth, you're going to have to brush them at least twice a day. There's something you're going to have to do, like working out, eating right, sleeping right for your health. So again, don't get in that mindset either. Do what you got to do. Again, I think I'm repeating myself way too many times. Give it a shot at restoring your endogenous production, though. I think you got a good chance.
Good answer. Thanks, Doc.